welcome to Mommy Needs a Break. It's a podcast for new moms who don't have it all together because clearly we don't have it together and we need a break. So thank you so much for joining us. I am one of your hosts, Megan Thomas at Meg Scoop everywhere.
And I am Marisa at She is Marisa J. Make sure to follow our podcast at MNAB Podcast on all social media. Make sure to also join our Patreon. Subscribe for $3 and you will get all of our lovely content. You will get our behind the
extras,
all our extras, all of our, what else we got? I feel like we're gonna be coming with some good
content. Yeah, you're gonna want to see it because I'm gonna do an exclusive dance battle with myself doing this a lot. So you should join the Patreon for sure. You guys, as always, we have great shows, but this week it's gonna be so much fun because we are talking all things vagina. I'm talking vulva, I'm talking clitoris, I don't really know any other terms, so I was just trying to say the vagina terms I know, but we're talking all things vagina, how to take care of them properly, what we teach our daughters about their own, and more. But first, meet our guest. She is beautiful. She is smart. She's my soror, and she is a pediatric and adolescent gynecologist. You guys give it up for Dr. Chimsum Oleka, better known as Dr. Chimmy.
Indeed.
Thank you.
I hope you like your intro, girl.
It was beautiful. Even the dance at the end, like it just sealed it, you know?
Well, thank you for joining us. Okay, so I have to tell you this. I know Dr. Chimmy from college. Like, she's my soror. She has always been amazing and smart and like super driven, and she's so sweet and like down to earth. And so when I found out that she was becoming a doctor and a gynecologist, I was like, yes! I could call her and ask her questions. And I'm like, I could just ask my own gynecologist, but I don't know. I kind of want to ask my friend. I know she's probably annoyed because people do that all the time, don't they?
No, they do, but it's fine.
Start charging a copay.
Listen, right. Okay, sis, go ahead and send it to Venmo, Zelle, whatever.
Right. Cash me $5.
I do not do that, no.
It's like, look.
All right, before we get started, we got some Ain't No Shame, right, Marisa?
Yeah, so Ain't No Shame is our mommy confession time where we, it's a no judgment zone basically, and we're able to, give our shameful parenting moments without judging each other basically, or calling the police or whoever is in charge. So today, my Ain't No Shame is letting your kids stay in the same clothes for 2 days. So what I've noticed is I will like post my kids on Instagram one day, and then like the next day I'm like, wait, they had that same clothes on. Was that our yesterday's story? And I'll like look at my story like, oh wait, they had the same clothes on. But to that, like they don't go outside. They don't play with anyone. They don't go anywhere, and they're clean. It's just like, why do I need to waste clothes? But I did realize, and when looking at my story, then I was like, why she got on the same clothes? And I look at her like, you didn't change your clothes.
Well, first of all, let me just say, for your children to be that clean and to not have to change clothes is a blessing in itself. Because that's the only reason I change Matt's clothes, or else he would have the same clothes on every single day. Okay, every single day, right?
Yeah, I mean, I put a bib on Halo when she eats like messy food because I know she'll destroy her clothes, stain it, whatever. But most of the time she falls asleep in her clothes, and I'm like, okay, well, and they're just house clothes. It's like a t-shirt, some little biker shorts, little stretch pants. And then the next day, maybe around 2:00, I realized they've been in the same clothes, and I'm like, oh, let me change you. For the house, I guess.
It's fine as long as she gets a little whole bath every day. Just face, hands, butt. Very important. Wait, Dr. Chimmy, how often should we wash our vaginas? Seriously.
Daily. It's a daily.
So, like, right. And you have daughters, you got to clean their vagina. At least, you wipe them down. Do their clothes really need to change? No.
I would say you can probably keep the same clothes on, but I'll probably change the undergarments.
Oh, yeah. I mean, well, you have to with the kids, like, especially, I mean, the 5-month-old, she has a diaper, so she change every hour, it feels like. And then the 2-year-old is getting potty trained, so she rarely has pants on. Yeah. She's running around the house, peeing everywhere, pooping on plates. So, I have to still clean her. So.
Wait, okay, so here's another thing. That reminds me, because of course, as you're potty trained, typically you just keep the bottoms out for kids and let them just like run so they learn. But Dr. Timmy, like growing up, I always heard you should sometimes air out, meaning like you shouldn't wear your underwears to sleep sometimes or whatever. Is that like a real thing?
Yeah, so it is a real thing. And we kind of use the term like letting your vagina or your vulva breathe. And some people are like, well, it doesn't have lungs, like you shouldn't say that. But the idea is that you're just allowing air to pass through, essentially. And if you think about it, and I know we kind of talked a little bit about just like sweaty vulvas, but there actually are the same glands that you have in your armpits that make you sweat. When you get hot, you sweat in your armpits. You have those same glands on your groin or in your groin area, on your labia majora, which are like the larger folds on the outside. So when you get hot and you think about it, like it's like you're crossing your legs, your vulva's like, hey sis, like it's tight down here, like we can't see, we got the legs crossed, no air is moving through. So it has those sweat glands that then start to sweat, trying to cool down that part of the body. And so sometimes that can lead to actually an odor because you have normal bacteria on the skin. And the normal bacteria on the skin then take that sweat and turn it into an odor. So really what helps obviously is, washing the vulva, which is the external genitalia, or the part that touches your underwear. And then sleeping without any underwear, at night, and like just like a loose gown or loose shorts, and trying to wear things that will allow air to pass through, like cotton underwear.
What about wearing no underwear?
If that's what you want to do, if you're comfortable doing that. Yeah,
I don't know.
Sometimes when I did like adult gynecology and the husbands or the guys would come to the visits with the patient, I would say that, they'd be like,
what she did. Wait, hold on. So what if you have like fat thighs and no underwear? It's still gonna be hot down there because your thighs are like this against
baby powder.
It still would be better to wear no underwear because if you think about it, regardless, of what your thighs are doing, if you have underwear that's like basically pressed up against the vulva, it's still going to decrease the amount of air that's going to move through, and it's going to make it harder for your body to just like thermoregulate itself. Whereas if it's just your own body kind of blocking it, your body's like, okay, that's us. Like, let's figure out how to, cool ourselves down. But it's harder when it's trying to adjust for fabric and clothing, essentially.
That's
I didn't like it.
I usually drive like this, just airing it out, ladies.
Just let it breathe. If you feel yourself getting hot in the middle of the day, just, lightly, just open it a little bit. We're good over here. We're just letting it breathe a little bit.
Let it breathe, ladies. You heard it here. Your vagina does have lungs.
Said the vagina does have lungs.
It does. Okay. So I have so many questions for you. Maurice and I are just like so intrigued by what you do because first of all, you are a pediatric and adolescent gynecologist. First of all, didn't know that was a specialty. Didn't know anybody was really caring about the little young ones' vaginas, but it makes sense. So like, the only thing that I can think of for your profession would have to do with like trauma. So like sexual trauma, right? But I know there's more to what you do and you deal with like from like babies on all the way up. So explain some of the other things that you do as a pediatric gynecologist.
Yeah, so like as a pediatric and adolescent gynecologist, I essentially take care of the gynecologic issues for girls day of life 0 up until 21 years old is usually kind of the stopping point. And really what that means is anything that affects the reproductive structures, the vagina, the external genitalia is really where and fertility is really where I come into play. So it actually encompasses a lot more than what people are aware of. It's a relatively new specialty. It came about officially like in the 80s, essentially. So it's still basically growing, but it's growing pretty rapidly because people are starting to realize like, oh, there's a need for this. Like, oh, so some of the things that we do are going to be congenital issues, so what happens if the genitalia doesn't form correctly, or what happens if, the genitalia doesn't form at all. You have girls who are born without vaginas and born without uteri or uteruses, and, what happens in that situation, or, the anatomy goes through a series of steps that it needs to go through in order to correctly become what it's supposed to become. So what happens if those steps don't occur all the way? You know, sometimes you have a duplicated system, or sometimes you have, you know,
two vaginas?
Essentially, it looks that way.
You know what? It's so funny you said that, because when my 5-month-old was born and she went for her like first checkup, the doctor was like, "Okay, no penis in there," and I was like, "What?" And he was dead serious, and I was like, "Oh, that's a thing." I had no idea. I thought he was making a joke, and he was dead serious.
Yeah.
He was like, "Oh, no vagina. I mean, no penis in there." Like,
Yeah.
Wait, so what? Okay, so wait, Dr. Chip, if you like come across like a baby that has I guess a congenital defect with her vagina, like, do you like reconstruct? Like, do you what?
oh wow.
Oh
Like,
my
it's
gosh!
crazy.
Yeah.
That's amazing.
So it depends obviously on a lot of things, you know, and that can be depending on one, like what caused it and what symptoms do they have. And that can be kind of a sensitive topic, just because it can get into the point to where you're making a gender assignment, you know, essentially, depending on how ambiguous the genitalia are. But in other situations, so if a girl was born without a vagina, you know, or without a uterus, usually they'll come to us when they're teenagers and they haven't had their cycles yet. They haven't started their period yet. And typically, you know, we'll do the imaging and kind of do an exam and figure all that out. And depending on where they are in their maturity, depending on, you know, what they want to do, will really determine if we create a vagina for them or not. So yeah.
Amazing. So so like you've created vaginas before.
Yes.
It's like, oh my gosh, that's like, because I wouldn't even, child, I barely look at mine in the mirror. So like, you're really like making one. What if like they don't have a uterus? You can't make that, can you?
No, you can't make it. And so I think essentially when we say make it, usually, and it's important to kind of say something about that a little bit more, is that the first line for someone or a young, you know, girl who's born without a vagina is actually dilation. So she's using essentially like a dilator and applying pressure against that area and stretching it out, so that it forms a vagina, because she has the space for it. Essentially, it just didn't really form. But there are surgical ways to create the vagina, and sometimes that can take place if they don't have success with dilation, which success with dilation is it's a pretty successful tactic. So we'll use surgical options if there's not success with dilation, or, you know, if they just would have a hard time dilating. But it's important because even after you create a vagina surgically, you still have to dilate afterwards in order to, you know, make sure it stays open and decrease, you know, stricturing and scarring and things like that. So if a girl's born without a uterus, that's a little bit tougher. We don't create, you know, uteri. There's not really a way to, you know, create that. There have been some cases of like uterine transplants which have happened, but it's not necessarily a specific thing that happens now for girls who are born without a uterus. But they usually will still have ovaries. They usually will still, you know, develop their secondary sexual characteristics and go through puberty, essentially breast development, that kind of thing. They just won't have their cycles. So we deal with that. We deal with childhood cancer survivors. How does that affect their fertility? You know, kind of counseling them through that. We deal with the usual stuff: irregular periods, painful periods, infections, puberty delays or early puberty or abnormalities of puberty. Really a lot. It really encompasses a lot of things. So vulvar stuff. So the vulva, as I said, is the external part of the genitalia. So if there's any, you know, skin conditions that affect the vulva, or any infections like genital warts that affect the vulva. Obviously, we talked about, you know, sexual assault, but then there's also so there's non-accidental traumas, which is sexual assault, and then accidental traumas. So if you have, we call those like straddle injuries. So you have, you know, girls who are playing in the bathtub, or they're trying to reach up on a cupboard and they fall down and, you know, fall right on their vulva. And there's, you know, lacerations and tears that we, you know, will have to, you know, repair as well. So, and then you get into ovarian masses, ovarian cysts, ovarian, you know, cancers. We'll usually pair up with the gynecologic oncologist for that. So it's a really fun field. it spans a lot of different areas. So
I see it. I was like, well, I didn't feel like you did all this, girl. You didn't made a vagina. You didn't look at the cancer. Like, wow, there's so much that you do. And I think, so what made you want to get into it?
yeah, so it's funny because I kind of tell this story and I'm like, I didn't initially, but I did. So I always knew I wanted to do like pediatrics. I always knew I wanted to work with kids, but I thought I just wanted to be like a general pediatrician, you know? So that was like my whole life goal, you know, ever since I was 7. I have like that cliche story, like I knew I want to be a doctor. But it's true, I did. And, you know, so I organized my life that way, you know, got into medical school, joined like all the pediatrics groups. I was in like all of them, met all the pediatricians, all, you know, I was like, hi, I'm going to be a pediatrician. Just want you to know my name, all that stuff. And then I got to 3rd year. So the first 2 years of medical school is really a lot of like book work, you know, learning your like basic, you know, clinical foundation, basic medical foundation, essentially. So the next 2 years are going to be clinical. So you're in the hospitals, you're doing your rotations. And 3rd year, I started with surgery because I was like, I'm not going to want to operate. Like, I'm not going to want to cut anybody. Like, that's not me. Like, I know myself. And so then I did my 3rd year rotation on surgery and I was like, wait, this is kind of cool. Like, I'm working with my hands, like, you know, but I was like, I don't want to work with the bowel and stuff. That's not exciting. So then, like, who wants to deal with that? So then I went to my 2nd rotation, which was peds. And I was like, this is what I'm created for. Like, you know, I like walked in the hospital, like finally, and I walked into outpatient peds and I hated it. I hated it. I was like, I cannot do another well child check. I can't hold another child down.
Wow.
I cannot hold another child down and look in their ears while they're like, I can't. Like,
Oh my
this is not
goodness.
what I was created to do. I can't. So I was like, oh my gosh. And I was like, well, you know, I could do it.
Yeah.
You know, so I found that I really liked inpatient peds. So I liked being able to like specialize in something as opposed to general outpatient peds. So then I had my OB rotation next. And I was like dreading OB because I was like, body fluids, like vaginal fluids, like, ooh, gross. And I still remember the first day of my rotation was labor and delivery. So I'm like this med student. As a med student, you just try not to be in the way. So you're like awkwardly like walking in like, hi, I'm a med student. You know, I'm just introducing myself. I'm going to be in the corner, just observing. So I was like in the corner, like in the back during this delivery. And I remember the resident at the time like looked back and he was like, come up here. And I was like, you know, so I go up and, you know, the baby was crowning and he's like, put your hand on the baby's head. And basically, obviously he was like helping, you know, deliver it. Obviously we had consent from the patient. But the first night I like delivered a baby. My hand was on the baby's head, but you know, I delivered a baby. And I was like, when the baby came out, just like that whole moment completely changed the entire tone. Like just seeing that mom and she was like, look at his nose, look at his eyes, look at like just that being able to be part of that moment was just beautiful. There's nothing else like that. So I was like, this is amazing. And then I went on through the rotation and just having the opportunity to really grow with women, to see women in different aspects that we go through from, you know, childbirth on labor and delivery to reproductive endocrinology and infertility to where you see women and families who are struggling to get pregnant to oncology where you see, you know, cancers that happen to the reproductive structures, you know, to just normal outpatient, you know, things. And I felt like it was easy to talk with, you know, us, you know, just walking in like, hey sis, what's up? You know, like it just felt very like natural and very fluid. But then also OB had like a variety, you know, it's not like you were sitting in the office all day, you were operating and you were doing procedures and you were talking to patients. And so I liked that aspect of it. But when I got into residency, I was like, I'm never doing a fellowship. I'm just going to do residency and be done. So the moral of this is that we really don't know ourselves, right? Because I walked in like, I know myself, like this is what I'm doing. And then as it went through, you know, my interest evolved. And then in residency, I still loved, you know, labor and delivery. I still loved delivering babies, but I felt like there was a gap in the education. You know, I felt like I had younger kids who were coming in pregnant, and you know, it would be things like, you know, the baby's in your uterus, and they'd be like, "What's a uterus?" You know, there's a baby in there. You know, like how have we missed this education? So I started to feel like it was important to start earlier in terms of education, to start earlier in terms of feeling proud of our bodies, understanding our bodies, knowing what they do. It can be a really empowering thing to learn that as you're going through that transition of puberty and of adolescence, and you're coming into yourself and you're becoming proud of yourself and your body and figuring out where your place is in this world. And that really was a lot of, kind of what started redirecting me to PD-GYN. And essentially I did an elective, my third-year residency in DC in PD-GYN, and I fell in love. I was like, this is it. It merges everything I wanted to do and puts it together. I got my peds, I got my OBGYN, and it just, it's been a beautiful fit. I literally love what I do. I really love it.
Wait, do you deliver pediatric patients' babies too?
Nope. So the funny thing about it is that after I did my fellowship, you do have the option. You can create the opportunity to deliver babies, to keep that obstetrics part. But I opted to not continue that for a number of reasons. It's a really, it involves a lot. There's a lot that goes into labor and delivery. There's a lot that goes into taking care of, pregnant patients, laboring patients. Initially, that was what drew me to it, but I feel like I could be better served focusing all of my attention on PD-GYN. So, and I'm okay with that.
I
know, because we didn't even know it existed.
So just to circle back on the education part, how do you suggest talking to our girls about their private parts, and what do you think a good age to start doing that would be?
So I think when they start to kind of recognize it, so when they start to kind of, sometimes as they grow, they're starting to develop their bodies, they're starting to, look at different parts. And sometimes that can be around 4 or 5 or 6, and they're playing, it seems like they're playing with themselves down there. But I think, identifying those and using the terms okay, I see you're, touching your, vulva, or, I see that you've discovered this, and, making sure that they understand it's and normalizing it. It's just a part of your body, your elbow, your knee, your vulva,
right.
And kind of introducing it in that way, and then giving them the correct terms to use. And that in and itself can be empowering. It doesn't mean that you have to have, your 7-year-old, Mom, I like my vagina, or you don't have to necessarily, it's still okay to use, nicknames or whatnot, but making sure they understand what the real names are. And that by itself can be empowering, because if something happens to them, God forbid, but if something happens to them, they're able to articulate, this happened to me in this area. You're giving them that power to be able to, and the language to be able to communicate what happened to them and where. And you're also able to help them, to understand exactly what parts are, private parts, essentially. What parts are, should no one really be touching or asking to look at, or should you not really be, someone's trying to show you that part on themselves, why would that be, inappropriate, et cetera, et cetera. So it's empowering when we know how to talk about things. And so really giving them that those tools can be helpful.
Because my 2-year-old talks about it now. She'll laugh. She's like, Mommy, I touched my pee-pee. And I'm like, oh, did you? And she'll point at me, Mommy, look at your pee-pee.
Yeah.
Or she'll say it to Terrell, my husband's Daddy, look at your pee-pee. And we'll be or look at your, or she'll smack my butt, Mom, look at your butt. And I'll be like, hey, well, what are you doing? But I don't react really, because I'll see her do it and laugh. She'll be laughing. Yeah. But in my mind, I'm wait, how does she know this already?
And most of the time, it's not in a sexual way. Most of the time,
no.
Curiosity. They're what's that? Or that's different. And they might get close to it and just, be looking and,
Yes.
So think about it. They're trying to learn. Everything is a learning opportunity. They're just literally taking around them. So most of the time, it's them just seeing things and trying to understand them.
Yeah. She comes in the bathroom Mommy, is pee-pee coming out of your pee-pee? I'm girl, get out of here.
I just need to be sure because that was what I'm trying to learn here.
No, you have to, like, even like for math. I mean, he's a boy, but he, like, I've taught him what his butt is. I've taught him his penis. So I'd be like, penis, and then he does a little thing where he like pushes it in, and I'm like, oh gosh. But like he like the boy life, but he knows what it is, and I was like very purposeful. Like I want him to know all of his body parts, including his penis and his butt, because I need to be able to identify and make sure when I tell you nobody touches these, you need to know exactly what part these are. So like, this is what it's called. It's called a penis. And he would be like, penis. And it was just like, push it. It's really funny, but it's also like, okay, but I'm glad you know where it is and you know what it does, because now you can pee from it and we can get your potty trained and you know not to let anyone touch it.
Yeah. And it's empowering, right? Like, you know, I always tell my patients, like, when they come in and they have an issue, I'm like, you should know what your vulva looks like. So it's like, you should be able to pick it out of a lineup. Like, there shouldn't be a situation to where you're like, I don't know, like, I ain't never seen it, you know, like, it's on you, you know, like, you should know what it looks like.
I would not be able to point my vulva out in a lineup.
You know what's crazy, and I haven't shared this yet. I went to my gyno last week. Dr. Hines, me and Megan had the same doctor. And she actually gave me a mirror. She was like, hold this. And I was like, what? She made me hold that mirror and watch everything she was doing. And she's like, now see this? You see this? Now watch when I do this. Watch when I do this. And I was just like, wait, what? My mind was just blown up. Like, because she like is very hands-on. She already is very outspoken and hands-on, but she's never done that. Like, hold this mirror and watch this.
So what was it like for you though?
I'm telling you, my mind was like exploded, but you know what was good? Like, I understood what was happening to me, and it didn't scare me because she like knew everything. She knew exactly like what I was talking about, like the issues I was having. And she showed me like what was going on with me. And then she told me what I can do to help, but like to be able to like see it without just listening to her tell me was a completely different experience. You know what I'm saying? Like, instead of someone just telling you the information and you're not seeing and knowing for yourself. Like, it was right there, you know. And it's different when you see it on a chart or like someone just shows you a picture and I'm like, so I look like that, you know? But she had me the whole exam. She had me hold up a mirror to my vagina, and while she like did her thing.
Oh my gosh, wow. You should be doing that all the time. I'm thinking of like all the mirrors I've ever had, and I'm just like looking at the poster on the ceiling. Just
so with my teenage girls, we have mirrors in the room, you know. We try to make them all, we have like leopard print and like, you know, whatever. Like, and a lot of them won't necessarily take that, you know, because they're still teenagers. I'm like, they're like, oh my God, no, you know, but so we offer that to them. And I think it's important for a number of reasons. One, it's less of a, I'm the doctor, I'm coming in to do this to you, and more of a, let's work together, let's participate with your body, you know, so let me show you what's happening to it. You feel comfortable, well, a little bit more comfortable as you can feel in a stirrup position, because you know, you can see what's happening, you know. And then if you have issues, you know, if you go back home and you're like, oh my gosh, like I have pain here, or I have, you know, this discomfort here, or I felt something here, you have the terminology, or at least, you know, you're better able to point to your provider. I felt it on the labia minora at the bottom, you know, like, or I felt it on this side. You're able to kind of to provide more information to the provider so that they can better help you, you know. And so it just gives you more tools and more pieces to the puzzle. So I love that. You know, that's something that we do in my practice as well. So.
Man, you have a really cool job. I know, but I know there's got to be like, you know, some tough times in it, especially when we're talking about like young girls. And right now, like, we know sex trafficking of our children is at a ridiculous rate. So what are some of the signs that you look for to, if it's trauma, especially when it comes to like children and vaginas? Like, how do you find that, or how do you know what it is, or how do you go, okay, she's saying this, but I see this. Like, what are some of the signs?
So that's an important point to make, because there really aren't any. And that can be kind of misleading in the sense that, you know, you'll have some parents, or, you know, really parents or guardians that will bring their daughters in and say, can you look and see if something's happened to her? Or can you look and see if she's had sex yet? Or, you know, there really isn't anything physically that can say definitively this has happened in this situation. If you think about it, then you have to define, well, what is sexual assault? You know, is it just penile vaginal, or could it be external? Could it be, you know, unwanted touching? Could it be fingers? Could it be exposing, you know, someone else exposing themselves to the young the young patient or the young person? All those things are involved. You can't prove any of those have happened. So really there's a lot of weight put on the story, you know, and put on the behavior of the child, especially with children. They tend to, you know, kind of regress in their, you know, in their behavior. They tend to be more irritable. Maybe they're nervous from being around somebody. Maybe, you know, they initially seemed really confident and they start wetting the bed, and when they were potty trained before, now they're a little bit, you know, less confident. They start to retreat into themselves. So those would be more, plus, you know, a story, you know, them saying, someone touched me here. You know, that's going to hold a lot more weight than an exam, because it depends on the type of assault that occurred that would even have the ability to provide any kind of, you know, trauma to the, you know, genital area or to the vagina. There are some where they'll say, you know, if you look at the hymen, if you see like a laceration, if you look at the hymen kind of like a clock, and so, you know, at the top is going to be 12 o'clock, at the bottom is going to be 6 o'clock. And so sometimes they'll say if you see like a notching at 6 o'clock, or if the laceration happens, you know, from 9 to 3 o'clock or 7 to 5 o'clock, or if there is kind of a repeated, if there's like a nodule at 6 o'clock that shows it's had to kind of repeatedly heal, then that can be a sign that you're a little bit more suspicious, you know, that you would want to kind of take seriously. But sometimes those can also, you know, in terms of the notching or the nodule, sometimes those can also be normal hymenal variants sometimes. So it's hard to say, you know, if the child is fine and you do an exam and you see that, it's hard to then say, I need to take you in and start this whole investigation if there are no allegations that have been, you know, made or brought forth. So that can be where it's tricky. There definitely are acute situations. So if you have a child who comes in with an acute, you know, laceration to the hymen that extends into the vagina, sometimes that can be a little bit more, you know, concerning, because it looks like there was some kind of penetrative issue. But then, you know, there are also other things that are accidental that could also be penetrative. You know, if you have a kid who's trying to climb up in the shower and you have a handle that's facing upwards and she slips and falls, you know, that could be a penetrative accident as well that is not, you know, necessarily sexually related. So the short answer of that is there isn't one. More so it's looking at the whole picture and listening to, you know, the patient.
Okay, that like it's so good that you say that, because I feel like at times, you know, like back in the day when, you know, women are considered second class citizens, so it's like, oh, well, if you're not a virgin, you're not worth as much. So like it's important to say that, because I feel like, you know, the whole hymen test, like, is her hymen there? Like, is it not there? I mean, some people can be born without a hymen, right?
So the hymen is
Hold on, wait, stop right there. Sorry, right there, because Marisa, are you okay?
Sorry.
You're right. I see you. Are you like
allergies? Are you crying?
No, like, oh my God, I don't even know if I should say this. That topic just like triggered me, and like it's a lot. I'm sorry. I wasn't expected to like.
Oh, Marissa.
Sorry.
Okay, no, take your moment, boo. I'm sorry. I want you to
take a break.
Okay.
Take a break.
Okay.
Take as much time as you need.
Don't worry, because we can cut this all out, girl. This is like recorded stuff.
It's heavy. It's hard. It's a hard topic.
I was just not.
Sure.
I mean, I thought I was gonna. I didn't even put things together what we were talking about today. Actually.
No, take your moment. Don't worry about it. We're just, you know, it is a hard topic.
Either cutting it out or giving like a little, this may be triggering for you.
Yeah.
It can be, you know, she would.
We'll put that. We'll put, if you want, we can cut this out, and then we'll put just, you know, this section right here that we're talking about, and then I'll put a disclaimer, and then also like if you have like if you have been sexually assaulted or you know anybody, here's the number, call that. So we'll put that.
Yeah, I don't think we have to cut it out, because I'm pretty sure I have to talk about it eventually, but I don't think I was like ready to listen to all that. Like I didn't like I don't think I'd processed this
Was
topic
it too
yet.
much detail?
No, it wasn't that. I think for me, there's I have two girls, and then listening to like being so young and things happening and not like having that control of like or a voice to speak for yourself or the things that you mentioned like might happen if something happened. Um, just thinking about my own experiences, it's like nobody spoke up for me
Yeah.
and or didn't know.
Mm-hmm.
And so like I think I blocked it out of my mind. So like hearing that and thinking about my two girls, it's like hard to listen to. Because you just never know like what your kids may experience. So I don't have to block it out. I just don't think my mind was mentally prepared to talk about these kind of things, you know, because I haven't dealt with my own things.
Yeah.
Or maybe I thought it didn't bother me or something, you know, but like listening to it
Mm-hmm.
was just like, it's just like,
Right.
you know.
But here's the thing, and you're already a step ahead, right? Your girls are already going to be in a whole different situation because
Yeah.
you're going to empower them. You know, if they came to you with something like that, you would speak up for them, you know?
Right.
So it's definitely a difficult thing. I mean, I think it's like 1 in 4, 1 in 5 girls have been a victim of this, you know, so, and the numbers could increase when you get into African-American, you know, girls. And so it's a heavy topic, you know, it's a topic that too many girls resonate with, which I think is also why you're gonna make me cry. I always cry in my clinic, by the way. They be like,
how can you do this, doctor? How can you do this? Like, I know you see this so much, and like, yeah, you can be a little bit desensitized to it, but at the end of the day, you see a young child. Like, how do you go home and like not just cry out every night?
Yeah.
You know?
I think if I ever became desensitized to it, that's when I should leave, you know, because I think there's value in being able to feel the pain or being able to empathize with your patients, because that allows you to be able to meet them where they are and to build, you know, a different level of connection between like a patient-physician relationship. So it is hard though. It is heavy, you know. And I think the main thing that at least I try to tell myself, is that this is why I'm here. You know, this is to make this whole experience. I may not be able to have prevented it from happening, you know, if they're coming to me after the fact, but I can interject at a pivotal and a crucial moment in someone's life and plant a seed of positivity, of understanding, of knowledge, of empowerment that hopefully will help them, along with all the other, you know, helpful aids that they're going to need, that will help them to move forward, and to help them to keep moving forward in life. And then it's the opposite also in trying to prevent, you know, this from happening, helping them to feel empowered in situations like that, to say, you know, no, or to tell someone, and to keep telling someone until someone believes you, you know. And I think that you know, it's a heavy thing, but it's what kind of keeps you in these particular situations. It's kind of what helps me know, like, this is why I wanted to do this. Part of the reason I wanted to do this, you know.
So wait, so Dr. Chibu, tell me this, because again, like you said, there's even in an exam, there's certain things you can look for, but you can't know for sure, like, was this sexual assault just by looking at, you know, doing your exam, or was this like just an accident, like that had nothing to do with sexual assault? What, as a doctor, I know you have a responsibility to, you know, report certain things. How do you know when to report as opposed to like, oh, it's just an accident? How, like, what are the steps that you're supposed to take?
Yeah, so I mean, the story is really going to be most important. Like, does it make sense? You know, who brought them in? How long did it take for them to bring them in? You know, so if you have a situation to where the accident happened last night, but she was bleeding, she's still bleeding, but we just went to sleep and we didn't want to bring her in, so we bring her in the next day. looks a little suspicious. You know, like, why would you not feel immediately concerned that there is bleeding from a possible trauma in the genital area? You know, so, but that also, you can have some people who may try to kind of treat at home, or they kind of underestimate how big the, you know, the laceration or the tear could have been. So it's kind of putting all the things together, and then obviously looking at the patient. You know, does she look terrified? Does she look like, you know, she doesn't want to say a lot? Does she look like, you know, what is the feel in the room? And then if you're at all suspicious or at all concerned, then, you know, you follow up on that gut instinct and say, you know, there may not be, you know, anything concrete here, but let's just do, you know, at least the screening test to make sure there isn't any infection that could be correlated with the sexually transmitted infection or disease. Or you continue to see them, you know, have them follow up after the repair, let them know it's a safe space, let them feel comfortable. Over time, if there's something there that needs to come out, they will know that this is truly a safe space, that they can trust you, and they can be, you know, forthcoming about what they may or may not have gone through. And that's with any assault. It's not, the point is not to have someone come in and then immediately open up. That very rarely happens. They need to feel comfortable. They need to feel safe. They need to feel like they can talk to you and be heard. And that takes time to really develop that.
Well, I just gotta give, like, for seriously, hats off to you, because this is so heavy. Like, anytime I hear or think about any type of child assault, like, it makes me want to fight a mother effort. Okay, like, so as a doctor, like, having to see this kind of stuff and just still, like, be like, I'm not gonna beat nobody up to, like, I don't, like, hats off to you for that, and you're doing a really good job at this.
It's hard. I know we record, so it's
you keep your job. We're gonna make sure you keep your job.
I'll say during fellowship, though, we did have a rotation to where we rotated through the our childhood assessment center, which is basically the center where, you know, any kind of sexual assault the child goes through. We rotated there, and part of that was we went to court and watched those, and that was probably the hardest thing. I couldn't actually make it through that, and I probably will never be able to do that again. So there's different levels of difficulty. You know, shout out to the lawyers who are, you know, also fighting for these patients on the front lines, because that is a whole other level as well.
Thank you for what you're doing, Marisa. You are loved.
That's also a small part of PD Night.
Right, you're ready for that, but don't worry, because I think this is therapeutic. This show is therapeutic for both Marisa and I, because there's stuff that we've gone on in our past. We've revealed stuff. We will soon reveal stuff that we, you know, just weren't ready to talk about yet. But, you know, I think this is a good platform for us to just kind of, like, because I feel like there's healing when you finally talk about stuff. You know what I mean?
Absolutely.
So thank you for what you're doing, Marisa. Thank you for being vulnerable.
Was I vulnerable?
Yeah. Oh. You are very transparent with a lot of stuff in your life, and I appreciate that, because I feel like more people connect with that, and I connect with you. So I appreciate your transparency, because there's, you know, even still, like, there's a lot of girls who deal with this.
Yeah.
You know, and like you said, especially women of color. Like, that number, do you feel like that number goes up in your patients when you see, like, sexual assault, as opposed to, like, just, you know, Caucasian or Black or woman of color? But do you feel like it's different when you're a woman of color?
I mean, statistically, the numbers are higher for, you know, younger Black girls. And I haven't 100% looked into it, but I could, you know, kind of give some ideas as to why, you know, younger Black girls are sexualized more frequently than, you know, younger white girls. Younger Black girls tend to go through puberty earlier than, you know, younger white girls or than their white, you know, counterparts. And then you have this also this education gap. You know, there are certain things that we may, you know, inadvertently label, you know, younger Black girls as certain things at a time when they're really trying to learn about themselves. You know, she's just fast. So why are you dressing like, you know? And when you have those labels put on you at a young age, you know, that does something to you. That kind of, like, weaves itself within your identity as it's forming. And then you have this, in general, as a teenager, this general lack of empowerment. You don't feel like you can be a true advocate for yourself in, you know, particular situations, you know? So if something's happening to you, do you feel empowered to speak up and say, no, like, no, I don't want this to happen to me? Or, you know, even if it's a situation that you initially wanted to be in, you know, if you change your mind, do you feel empowered enough to speak up and say, you know, I don't really want to do this anymore? You know, as a teenager, you tend to feel less empowered. That goes back to confidence. You know, do you feel confident with yourself? Do you feel like you can confidently speak up and advocate for yourself? You know, and that's, again, something that's developing as a teenager and as an adolescent. And I find that a lot of us as adult women are still carrying a lot of the labels that we, you know, either were attached to us or that we, you know, kind of stumbled into or whatnot as teenagers. And I think being able to kind of get into that identity form, that time period of identity formation, and really empower girls to not feel like they have to take on labels that are, you know, attached to them, you know, to not feel like they have to, you know, be what other people may see, you know, in them, is empowering, you know, to say, okay, I know that they see that, but like, how do you see yourself? You know, I know that they might say this about you, but like, how do you see yourself? You know, or if you were in the situation, what would you do? You know, and I think that can help to free, you know, a lot of those things, or keep them from happening. Ideally, that's the hope, right?
I think it's important, you know, to have doctors like women of color, because I feel like before, it wasn't until my gyno now, Dr. Hines, she is amazing. Like, she's the only reason why I'm at Kaiser.
That mirror, I was like, she's good.
Dr. Hines is the shit. Okay.
Yeah.
Like, she is the lead doctor.
I'm like, I want to see Dr. Hines.
Like,
wait, you know her?
You know
No,
her?
I'm saying I want to see Dr. Hines.
Oh, Google LaTanya Hines.
Not to fly out the
Yes, she does not.
She is always booked. She is like over capacity. People drive from everywhere to see this woman. She is the lead doctor at the Baldwin Hills Crenshaw. Like, she is the bomb. And it wasn't until like I was her patient, I felt like, until like I was empowered to ask questions. Like I said, Dr. Hines is booked, but when you're with her, it's like you're her only patient of the day. Like, I started writing down things before. I never did this before, like writing down questions I want to ask her. Like, I will spend all day with Dr. Hines just talking to her about everything. And she is so invested in the Black woman and making sure we understand what is going on with our bodies during pregnancy, after pregnancy, like, and she spends time with you. You know, and she gives you that like authority back of your life. Like, oh, I'm in pain. Like, okay, well, let's figure out what this pain is, you know, like she gives that back to you. And I feel like that's so important. Now I'm thinking like at a younger age to have that, you know. I think I need to make another doctor switch. I've already switched like 2 times for my kids. But, you know, it's important for them to have that, like that face to face with someone that looks like them. To me, you know, to be able to feel comfortable at a doctor to talk about it. Because before her, it was just like an in and out thing. It was like, okay, you're fine. I'm like, but I'm not fine.
And I hate that.
You know what I mean?
Yeah.
Like, I'm not
I mean,
fine.
I've had that experience, like as a gynecologist, you know, like going in to see a gynecologist and, you know, feeling rushed, feeling like I'm not her. Granted, I don't always tell them what I do because I'm trying to kind of see, how do you see me knowing, you know, that I'm one of you, because I think that's important. But, you know, and I think that I hate the visits that are rushed. And I think it's important to take time. And I think most doctors who really, you know, care about the medical aspect of it try to do that. The system itself doesn't really allow us to do that for as long as is probably needed. So that's a whole other talk. But I think it is important to take that time, especially with teenagers, you know, like, I mean, initially it used to be that there were 15-minute visits that I had. And I was like, they can't even pee for the pregnancy test in 15 minutes. Like, you know, because
I want to ask this. So you mentioned before that Black girls tend to start their periods earlier than their counterparts. Is there a reason for that? Do we know?
Yeah. So in terms of puberty and periods, the two are kind of different. So when it comes to periods, the difference the average age of the first period is like 12 years old. The difference between African American and white is going to be 7 months. So it's not a significant difference in terms of, you know, period starting. When you look at puberty, there could be what might be considered a significant difference, but that's still, the jury's still out on that. There was like a recent study that came out that's looking at, you know, are kids going through puberty earlier, and why? And, you know, it's found that we used to say traditionally that anything less than 8 years old, so development of secondary sexual characteristics like breast development, pubic hair, anything under 8 years old is too soon. But what they're finding is that maybe that needs to be revised. Maybe it needs to be for, you know, white girls, anything less than 7 is too soon. And for Black girls, anything less than 6 is too soon. That's not necessarily something that's been adopted yet, but it's out there. It's kind of swirling around in terms of, you know, should this be something that we adhere to with a couple exceptions to that. So
wait, what do you do if you have a girl who has like gone through puberty that early?
You try to stop it. Yeah. Because
what do you mean? Try to stop it?
Yeah.
Like hormone therapy?
Huh?
Like, how do you stop it? Hormone therapy?
Yes.
I know, our face were like, what does it
You're both like, stop it. So yeah, because when you're going through puberty that early, it's problematic for a lot of things. I mean, there's a psychological issue, you know, obviously, to be having a period at 6 or 7 or 5. And then you also want to look at why. Why did we start going through puberty early? And there's 2 different types of early puberty. So you have central puberty, central precocious puberty is what we call it, which means the brain just turned on too soon and basically just started the whole system. And then you have peripheral precocious puberty, which means there's something somewhere in the body that's producing hormone that basically has started puberty either on its own, or it started it by turning on a switch in the brain to then turn puberty on. And so essentially you have to figure out, why did it start? Like, is it a central issue or is it a peripheral issue? Is there, you know, a tumor or a gland somewhere that's over secreting a hormone? And then you basically treat it based on that. So if there's a tumor or a gland, then you obviously try to decrease that either by taking it out or more commonly by, you know, a medical intervention with like a medicine that's taken to decrease that. If it's central, then you basically will decrease the stimulation from the brain to the ovary with a medication that kind of puts them in like what we would know as like a menopausal state, but it's really not menopause. It's just putting them back to where they're supposed to be. The reason why is because once you start having your cycles, your growth plates fuse. And so you start to get kind of this stunted growth, not very tall, and all of those things are important. So we try to do that, and we will work closely with endocrinology, the pediatric endocrinologists, because they're going to be the ones helping to monitor like the growth hormone and also doing some additional testing to look at how the brain is communicating with the ovary. And making
Do you think food has anything to do with it?
So there's a lot of thoughts about puberty, and I kind of get into this too because I work with athletes as well, and so that's all just kind of like rapidly emerging because we have you know, a lot more girls participating in intense athletics from a younger age, and so how's that affecting their puberty and their pubertal development? There's a lot of thought about, is it food, is it weight, is it environment, is it genetics? I don't really know entirely. But there are certain things that need to be in place for puberty to occur. And sometimes there's a thought that sometimes there are certain things that we eat, or if we tend to have kids that are a little bit more obese at younger ages, they're reaching a certain percentage of body fat earlier than what would be expected. And so the body then may think like, okay, we're further along than we are, and then start puberty that way. But this is all, you know, nothing is really 100% set in stone at this point.
That is so like fascinating to me, especially like the whole the athlete part. And I wanted to ask you this, like, you remember years ago there was a track star, Caster Semenya, who had both, you know, when they tested, she ended up having both I guess male and female parts inside. And there was a lot of people that were like, that's not fair. She can't run with the women because she makes testosterone, which means, you know, she can run faster and she's always going to win. It's not fair. And then there was, of course, people like, no, she's a woman, maybe she has an edge. That's not her fault. She should not, not be allowed to run with women. So like in a situation like that, would you have to like stop a certain hormone, or would you just be like, hey, she's fine, that's her life? Like, it's not, if it doesn't affect anything, like she can it's fine. If you have like a teenager that is dealing with that, what are some of the ways that you would try to like work with that to figure out what the right approach is?
And that's a really hot topic question in the field of female athletes, because there is like this emerging interest in just how female physiology plays a role in athletic performance and injury, how's the period related, and that's an area that we really are just learning a lot about, because most of the information that we have was used from men, because a lot of the previous scientists and researchers didn't want to do the research studies with women because the menstrual cycle. They were like, it's just too complicated. Like, we don't want to have to like figure it out. So we'll just use men and then just use the information for women because they're basically like little men anyway. We're like, totally, that's literally how it's been.
Right.
Except we're like actually not. Like our whole physiology is completely different. And so I think now since Title IX, which is where you had a lot more female athletes coming into the organized, sports scene, we're now seeing almost a even number of female athletes and male athletes. And we're realizing that you can't train them the same. There are inherent physiologic differences that are occurring. And one of those, in that particular instance that you brought up, I don't know that it was actually disclosed what her medical issues were. I think there was a lot of like speculation, and then it just kind of flew. I don't think it's actually out there what her medical issues are. But I'll say that most elite athletes will have something unique about them. Like Michael Phelps's wingspan is like unreal. That helps him to become a better swimmer. That helps him to be the champion that he is. And so you'll have most athletes that will have something that kind of sets them apart and kind of puts them, above an average person. When it comes to testosterone, we don't really know how much of an advantage that can be for female physiology. We know what it means for men. We know that, that's one of the things that can be used to, make them more competitive and help them build muscle mass and, lengthen their endurance. We don't necessarily know how that works with women. If you look at something like PCOS or polycystic ovarian syndrome, where you have this naturally occurring elevation in your endogenous or your physiologic testosterone, that's not necessarily an advantage, because that gives you hair growth, it gives you acne, it gives you increased weight around your belly. Like, those aren't things that make you a better athlete, so maybe it's different in women, we don't know. And in that particular situation, she wasn't, I feel for her in that situation. Yeah. I'll just say that, I don't know that it was entirely fair. I don't think it was fair.
I mean, and like on top of that, like, you have to think about it. She didn't know anything. You know what I'm saying? She's just living her life, and next thing you know, they test her and they're like, "Hey, so like, that's not fair." Okay, so what? If I have this extra stuff, I'm gonna win. Guess all right.
Yeah.
What you gonna do? Like, that's like you said. There's some people just have some physiological things that just gives them an edge, and that's what gives her an edge. I don't know. That's my opinion on that, but
to stay on the athlete topic, you often talk about sweaty vulvas. What can we do? And even, us moms trying to lose weight, out here trying to work out, what can we be doing to practice, healthy hygiene when we are sweating a lot? It's hot, we in the house.
Yeah.
What can we be doing more of?
That's so funny. I didn't realize that would be such a hot topic when I posted. You would not believe how many times people bring up sweaty vulvas.
Man.
We're all here struggling, but it's an important question.
Like, don't touch me. I just worked out. I'm so sick.
And it gets back to the fact that the same glands in our armpits are the same glands that we have in our vulva region. So in our groin, on our labia majora, which are the larger folds on the outside of the external genitalia, they have those same glands, and so they're going to start secreting that sweat when you get hot, and then the normal bacteria on your skin is going to turn that into an odor. And so essentially the sweat is normal. And I think that it's important. There's just a lot of physiologic things that we go through as women that we feel like we have to cover up or, fix, even though it's just normal. Like, it's just how our body just does what it's supposed to do. And I think that's part of it. It's just like normalizing, like, hey, my vulva sweats. If you're like working out and you see like some sweat in that area on your pants, like you don't necessarily have to be like, oh my God, like everyone can see, they're gonna think I peed on myself. No, like it's just how my vulva works. Like if you knew vulva physiology, then you would know. Like, so I think that's also part of like, empowering girls, because that can be, a point of where they might get teased and they might start to feel some kind of way. But if they know, like, my vulva sweats, and the fact that you don't know that just shows how ignorant you are, and then they walk away, they feel empowered in that situation.
So do you embrace the camel toe? I only asked this because Terrell was trying to post a picture this week of me, and I was like, no, don't post that. You can see my camel toe. No? I was like, what?
No. I was just so.
I mean, it gets back to, some women will choose to work out or to wear, clothing without any underwear underneath. Depends on what the fabric is. If it's cotton, it's breathable. If it allows air to pass through and that's what you want to do, that's fine. If you want to wear spandex, air doesn't really pass through spandex. It's not breathing, but you want to make sure that you're getting something that's going to wick that moisture away from your skin. That's the key, is wicking that moisture away from the skin, which is going to be, like a microbial, like a moisture wicking fabric that kind of disperses that sweat through the fabric and then allows it to evaporate from the actual material instead of staying stuck to your skin and kind of pooling in the pubic hair. Sometimes too, I mean, pubic hair can be, what you do with that can be a very personal thing,
The waxing salons have been so closed. This is like,
that's not like a deep statement.
This is so
I know, and if you try, have you ever tried to wax yourself?
No, and I don't.
Is the word. I don't know what I was thinking. Okay.
I don't either.
And it's like right at the top, like the front part, like where it hurts the worst. Oh, child, I was like, I'm about to die. I thought I'm about to pass out.
It's like when I had my second baby, I made sure I got waxed on a schedule to the moment I had her, because I was like, I will never go back to not doing it. It's the worst thing to start over and try to do it again. And then COVID hit. And I just
now you're just a
everybody does it. So sometimes, depending on how long it is, that can also trap moisture and bacteria. So sometimes if you're struggling with odor and sweat when you're working out, sometimes trimming that pubic hair can also be a little bit helpful if you're struggling with it in that situation. But
go ahead. I'm sorry.
Yeah, no, go ahead.
No, I was gonna say, so like, so there's this company that makes like man's ball deodorant now, which is like, can we get like deodorant? But like, it's basically just like, I guess it keeps the balls from like sticking to the legs. So I feel like we should get like a vulva.
Look that up.
Right. I'm like, wait, what?
It's from a company called Manscaped, if anybody.
I've heard of that.
If any of you ladies want to get your man something,
I have heard of that.
I mean, the ball deodorant apparently worked wonders. I got it from Marlon, he said.
Did you?
It's cool. Well, I learned about it from, I work with all guys, and so they're all like, yeah, the ball deodorant's amazing.
Ball deodorant?
I was like, okay, well, I'll get that for my man as a present. So I got it. He's like, yeah, this is cool. But honestly, I feel like it's just like some kind of a gel that turns into like a powdery, like.
Yeah.
I felt it. I was like, okay, it feels like, but yeah, it's apparently supposed to keep the balls.
Is it on Amazon?
No, it's on, you gotta go to their website. But look at you looking it up now, Marisa.
I mean, I'm just like,
I need to find this. But wait, but could we get but that's another thing, because I feel like vaginas are way more sensitive than men's like balls and penises, right? Like we can't just be messing the pH up down there.
Exactly, and that's really what it comes down to. I mean, there are some things that a lot of women will swear by and they'll adhere to, like their summer's eve or whatnot. They're like, I always put it on because I have to smell a certain way. If that's working for you and you don't have any issues with it, then by all means, continue to do what you've been doing. But if you're having issues, if you're having, repeated infections or irritation issues, that would be the number one thing to go. The vulva isn't necessarily supposed to smell like lavender. Like that's not it's not a natural scent for it to smell like, tropical breeze when you wake up. It's just not how the vulva, smells. But It's more so a matter of keeping.
It's supposed to smell like armpit apparently because it has the same blanket.
Wait, shameless Black business plug. Go to the Honey Pot.
Yes, that Honey Pot. They make some great products for your lady part.
Natural product.
So, you know, it's supposed to smell like vulvas and vaginas. It's not supposed to smell like armpits.
Wait, but can you, we're like going so off topic. These are none of our questions. But can you do like the eating pineapples and like all that crazy stuff? No.
Wait, is that what Erykah Badu said? You're supposed
well, actually, I've heard some of the founders of these products who talk about what you eat can like be a reason of why you smell a certain way. Like what you put in your body could ultimately like make you smell.
So
I don't know.
I mean, there is some thought to that. You know that if you eat like asparagus or Brussels sprouts or like your, urine is going to have a different odor to it. But it's hard to know if that's going to be the same vaginally. And if so from like a medical standpoint, everything that really I use is like evidence-based. So it would be really hard to conduct a study that would show us the findings that we would like. So it'd be like, okay, all these girls ate pineapples, and then how would we know, like, if someone's smelling all their
Open your life.
The same people who smelled Erykah Badu's vagina to make her incense will be conducting the test.
How do you prove that?
It's Badu, I don't know. It's something. If you look it up, she sells it. I was like, oh, that's interesting.
So, it's hard for me to say medically that, if you want to try it and see how that works, then, go ahead. But that's
really funny. You brought that up too, Marisa. I'm glad look, I just love Chimmy. You know what I'm saying? She has the greatest way of like answering stuff the way it answer.
I'm like, oh yeah, wait. She is
still being like really But like, no, my hunger, she's a comedian and she's plus size, and she was like, it is so true what you eat affects your vagina down there. Why you think these men like big girls? Because they, vaginas just be dripping. Because where you think all this butter and mayonnaise go?
But you know what?
I'm thinking about that. I'm like, wait, they're like,
no. But you don't want it like mayonnaise? No.
But you know what?
It gotta go somewhere, Dr. Jimmy. Where's it gonna go?
Through like orally through your gut and out through your rectum. It's a whole GI tract. It's a whole GI tract.
But you know what's funny? My doctor is similar because she knows me and she's like, she always has to remind herself like, oh yeah, Marisa, you are like, you're natural, right? You try to be more natural, right? So she tries to answer my questions because I ask her these same things. And I know there is a by the book. And so she does try to answer my questions in a way where she's trying to help me, but she can't technically tell me these things. It's like, just go try it out. And you go tell me what you find out.
You can ask her if your vegan mayonnaise is gonna make a difference for your vagina. If I eat the vegan mayonnaise.
As long as you don't put it in the vagina, we're good. Like, do what you want to do with the mayonnaise. Don't put it inside.
I want to know who said that, Megan. Now that
it's not gonna work for you.
Okay, wait. So I need you to tell us this story. On your Instagram, you tell a story about like your whole first period experience. How old were you? You were practicing period. Like, tell me what happened.
So I think I was like 12, 13. And so essentially my mom's like a labor and delivery nurse. And
oh, wow.
Yeah, which was like why I didn't want to go into OB, but clearly she was just like, whatever. So she knows me, I guess. So I apparently was like, she told me that I was going to get my period. And I, being the person that I am, wanted to prepare. I like to be prepared for things. So I was like, I'm going to practice my period. So I had these pads that I would use, and I would have like period practice. So I would just practice putting the pad on, and then I would walk around and I'd be like, feeling like I was doing something, like not having any bleeding whatsoever. Like I was like, when this comes, like I will be ready. So basically when the day actually came, I remember I was on a school bus and I was like, it feels different, but I was like, I don't know, it's probably nothing. Because you feel like it's gonna be this like, life-changing, like I will know because this like waterfall of blood will just rush down. Like you just have in your head like it's gonna be this like huge moment. And I remember I got to school and I was like walking and I was like, it feels a little weird, but whatever. And then this teacher came over to me and she was like, stay right here. And she like turned me to like my back to the wall. And I was like, I'm trying to get to class. Like I was like, this is weird. And she came back, she had me a pad and I was like, what? And she was like, your period just started. It's okay. Sometimes it happens. I can see it on your khakis. And, here's a sweater. And I was like, more devastated because I missed it than the fact that it had actually like, I was like, all of that practice, all those practice pads, and I missed it. I was not ready. And that was a really, important lesson for me to learn early on, is that you can prepare for
to that teacher.
So you practiced your period.
Megan, that sounds like something you would have done. When you were telling that story, I was like, this sounds like Megan.
I think that's why I appreciate Chibi so much, because it's I didn't practice, but I was like, okay. Because, I skipped a grade. So all of my friends were older and had already started their period. So it was like, so I was very intrigued. I was like, so what happens? Like, how do you know it happened?
Yeah.
Because I was like, I need to know when it happens for me. And, and they were like, we use tampons. And I was like, oh my gosh, how do you even put that in?
Oh my God.
How would you put that there? So I learned, I felt like I was ready to go. And I told my mom, I was like, hey,
I told my mom.
I told her, because I was like, I think I asked her, like, when did you start your period? She's like 12. So I was like 11. I was like, okay, so it's going to happen for me soon.
It's coming.
I need you to get me some pads because I don't want to use tampons. I'm just going to use the pads. So she was like, okay. So she had got me some pads. So they were just like sitting there. They were probably sitting there for like a year before my period actually came. And then the day, I don't know what happened. I think the day it came, I like wiped and, got up and got to flush, and I looked and there was blood and I was like, oh, Mom, look. And so, of course, there's like doo-doo in there too, but she was just like, flush, Megan, just flush. I was like, look, it's blood, right? That's blood, right? I was like, wait, do I need to look and make sure it's coming out like that hole? And she's just like, just go get those pads and been sitting there forever.
I think my oldest daughter would be intrigued and would practice like you. I honestly think she would do that. And I think that is something I'm going to do with her. Like, just as her mom, just like, you're getting older, let's practice. Even now, I look at her legs and I can see, there's no hair on her legs yet, but I can see the little hole trying to form. And so her little baby skin is starting to change a little bit. And I'm like, oh my God, you're going to have a period one day. But you know what, too, I think it's funny because I don't remember the exact moment for mine. But I remember right after, I was in a room with my mom for like hours. And then she started having the sex talk with me. Like instant. It was like an instant, like, okay, now you have to have this talk. And I don't remember like what that talk even was, to be honest with you, but like I feel like a lot of people correlate that with that.
Yeah.
Like, now that you have your period, now we got to talk about sex. Like,
but,
right now.
Right. You're like, well, can we talk about my period first? Like, what does that?
Right. But
that's so hilarious. But I get it, because once you're having your period, technically you can get pregnant. So understand the full scope of things. But I feel like it's good to definitely, and some people get really into it. Some kids get really into it. They're like, period practice. They have a little period kit. They have like a little period party. They feel like it's their personal responsibility to educate everyone else.
Remember, Megan? We had a guest, the doula. She said they have period parties with like tents and everything. Remember?
Yeah, they do. Yeah, she was telling us like I guess some cultures do that. So
yeah,
I was like, oh, they have a whole party for that. I didn't get nothing.
Right? What I get?
Some kids who just like try to pretend like nothing's happening, and that's where you have to be like,
yeah,
we're gonna have a party. We're gonna have a cake.
Normalize periods, ladies. Normalize the periods.
Normalize the period.
All right, Dr. Timmy, we're gonna get out of here soon. Are we this is, first of all, this is a long episode. We did not plan to go this long with you, but you have such an interesting, very important job. Yeah. So thank you for spending the time with us. But before we let you go, I just want to know, what is one thing that you want mothers to know to talk to their daughters about, especially when it comes to their bodies?
One thing. Whew, that's tough.
I mean, you can name more, but we done already went this long.
Right.
I think it's important for mothers to just normalize the changes that a developing body is going to go through, and to help the child or the teenager feel comfortable as they go through their body, as they go through the change that their body undergoes. And I think we've kind of touched on that. It's just, knowing what the parts of your body are, knowing how to clean them, knowing, the terms to use to communicate about them. I think just that in itself can be really empowering. And I know we didn't entirely touch about it, but I just will briefly just talking about the different kinds of touches, which I think can also be really empowering. And it used to be that we say like good touch, bad touch, but I think that kind of makes it harder to really differentiate between certain types of touching. And so I like to kind of use the safe touch, unsafe touch, unwanted touch. And so what that means is that an unwanted touch can still be safe, a safe touch can still be unwanted, but an unsafe touch is never okay. And a safe touch is basically a touch that keeps you safe. It's good for you, makes you feel cared about. A high five, it's a hug, something like that. But you can still have a safe touch that you don't necessarily want. You may not want someone to hug you or to high five you. And allowing them to put those boundaries on their body is important, to say, I know it's a safe touch. I know you don't mean any harm by it, but I don't really feel like being touched right now. That's such an important thing for them to understand, because then they'll feel more empowered and able to advocate for themselves in situations that may come up in the future.
Where would you call that out? I'm just curious.
What do you say?
Like, where would you call that out? Like, what moments would you teach that?
So if you have family members who are coming over and you're like, go give them a hug, they want to see you, and you have this younger child who's like clinging to your leg, like, I don't really want to hug them. Like, no, go hug them. That's
yeah.
It kind of reinforces this, like, even if you don't want to,
you have to do it.
Yeah.
Right.
And it's not meant in like a malicious, like we all, have kind of been in that situation, but it kind of, it doesn't allow them to put the boundaries up for themselves.
Yeah.
So you can explain, like, this is a safe touch, like they mean well. If you don't want them to touch you or give you a hug right now, that's okay. Maybe later you'll feel up to it, and then making sure that the family member understands that. There's also an unwanted touch that can be safe. So it's like if they like have a splinter and you got to take out the splinter and it's painful, they're like, I don't want you to do that, but I have to do this for you in order to help you. So they also understand that there may be certain things or certain situations where that may come up that are generally okay because it's helping them.
That makes sense.
Yeah, and then obviously unsafe touches we've talked about. So I think those things can be generally helpful, but it's more so just about helping them to feel comfortable in their bodies, to know their bodies, and that in turn helps them to speak up for and protect their bodies.
Oh my gosh, this has been so educational.
Seriously, I'm like, I'm gonna go take a nap, Megan. We're not hanging out. I'm gonna go take a nap.
This is Dr. Chimmie, thank you so much. We've got a couple more things we want to talk about, but where can people find you on social media so they can get more of this amazing information and fabulousness?
Yeah, so you can find me on Instagram, probably where I'm most active at @withlove_Dr. Chimmie. I'm on Twitter, but I tweet like once every 3 months. @love_Dr. Chimmie is there too, but Instagram's probably the hub.
Okay, cool.
So before we get out of here, we always want to leave some inspiration for you to remember that, Mama, you are fine, not just physically, but mentally, spiritually, emotionally, even when you're not feeling like it. So today I have to keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. And that's from Buddha. And it's just a reminder during this time, we're still in COVID, we're still in a race war, civil war. What other war are we in? I don't even know. It's like a new one. Gender war. There's a COVID cure. There's not a COVID cure. All this stuff is going on. So it's just a reminder, you got to take care of yourself, because if you don't, who will? And then how will you take care of others? If you got a husband, if you got a kid, if you got family members you got to take care of, you got to take care of yourself first. And so we had someone on last week and she's like, even if it's 5 minutes in the morning, just get up and go do something for yourself. And that really stuck with me last week or 2 weeks ago, whenever that was. So just make sure to do the little things every day to make sure you are okay.
Ooh, that was some gems right there. Dr. Chimmy, thank you so much for taking time with us today to really explain and listen to like how crazy our questions are. I'm sure you're like,
I have so many more, but I was like, I don't think
I
this
can tell you,
about
every
this.
gynecologist has heard there's no crazy question.
So thank you for answering our questions. Thank you for being a doctor who is like committed to this field specifically. And on top of that, thank you for being a doctor during this whole COVID pandemic that, you know, like you're literally putting your life on the line every day you walk into the hospital. So thank you for your service.
Thank you.
And you can bill us later, girl. Because we sure we ask you all these questions that we need to pay a copay for, okay?
No, this was awesome. Thanks for inviting me.
Thank you guys. You guys, thank you for taking a break with us. As always, we hope you'll take a break again with us next week because we always have great guests on this show. Please follow our guest, Dr. Chimmy. Give your Instagram handle one more time.
With love _ Dr. Chimmy.
Yes, follow her. Follow me, Megan Thomas at Meg Scoop.
And follow me, Marisa. She is Marisa J. Make sure to follow our Mommy Needs a Break podcast at MNAD Podcasts all over the internet. And make sure to visit our website, mnadpodcast.com. And we will see you next time. Bye.